Let's get reaction. Cantor is a Republican from Virginia, also the House Minority Whip. Congressman, good to see you. Speaker Pelosi says this comes in under the president's budget, that he wanted it at $900 billion or less. She says it comes in at $894 billion over 10 years, and it's fully paid for. Your reaction?
Well, Jane, I think, first of all, you've got to say, here they go again. Same debate, different day. This is a gargantuan expansion of government takeover of our health care. This is paid for on the backs of seniors' benefits to the tune of almost $500 billion being taken away from the Medicare program. It's also calling for higher taxes on those who have insurance, as well as payroll taxes on employers. All of us have seen the studies who show that everyone's insurance premiums will go up because of this. Again, this is not what the American people want, and I look forward to having the debate on the House floor next week.
Let's put up this poll from the Wall Street Journal that I'm sure you saw that was out yesterday. The question was, how do you feel about a government-run health insurance option? 48% said they favored it, just 42% said they opposed it. Does that fly in the face of what you just said, that this isn't what the American people want?
You know, Jane, I think you have to look at the wording of these polls. Many of them are asking the question, would you favor a government option that would compete with your health care? And I think all of us know that competition would bring about lower prices. But Republicans believe that the government can't be a fair competitor, and if you put the government in place with an option sponsored by the government, it will end up replacing your health care. And if you make that point and ask the question honestly, you will get over two-thirds of Americans to say, absolutely not. We don't want a government takeover of our health care.
Let's talk about what you can do being in the minority party at this point.
Well, listen, I mean, Jane, the striking thing that occurred today is when the Speaker had her announcement and unveiled their public option. She did so on public grounds in the west front of the Capitol and, frankly, denied access to the public. You know, I think that says a lot about what's going on behind closed doors and the process through which the Democrats are going about crafting this legislation. The people in this country need to know exactly what's at stake. There is not a question in my mind that this plan will aggravate the deficit and will be paid for on the backs of seniors and small businesses. This bill won't do anything to improve health care in this country. And that's why the Republicans, we believe there's a better way. We believe that we ought to go about fixing the problems that exist and allowing folks to keep what works.
Congressman Hoyer was with her, the majority leader, and he said this is the most, you talk about closed doors, he said this is the most open and transparent bill that he's seen in his almost 30 years on the Hill.
Well, I think, first of all, Jane, you start off with they didn't even allow the public access to their press conference. That's number one. Number two, I think the majority leader said to me publicly on the floor of the House last week that he didn't see any reason why he should talk to Republicans if we didn't support the government option or what we believe is a government takeover of health care. This has been the most one-sided process, I think, ever in terms of the type of legislation we're talking about. This legislation will transform health care as we know it, and frankly, most Americans have insurance. Most Americans will not be able to keep the insurance that they have, in addition to seeing costs skyrocket because of this.
Well, there's a lot of debate to come. Congressman Cantor, we'll see where it goes. Good to have you. Thank you.